Welcome to Social Work 525 Demonstration of Interviewing Skills by Nardine Ibrahim and Erica Lucio. Contributions: Nardine, script writing, editing, research, slide preparation, role play, and video editing. Erica, script writing, research, slide preparation, editing, role play, video editing. Client description. Client is 45 years old woman experienced significant stress and anxiety due to financial difficulties and conflicts with her teenage daughter. Presenting problem. The client exhibits ongoing stress and frustration related to frequent conflict with her teenage daughter, alongside feelings of self-doubt and in her parenting role. History. The client has been navigating the challenges of single parenting after managing family responsibilities largely on her own. She often feels overwhelmed by balancing her role as a mother with other demands, which has contributed to her feelings of self-doubt and stress. Strength: caring, resilient, and committed to fostering a positive relationship with her daughter, despite the challenges she faces. Diagnosis: client has been diagnosed with generalized anxiety disorder. Modality: individual session.
Intervention model: cognitive behavioral therapy. Cognitive behavioral therapy is a structured, goal-oriented form of psychotherapy that focuses on identifying and modifying negative thought patterns and behaviors that contribute to emotional distress. It is based on the concept that our thoughts, feelings, and behaviors are interconnected, and changing unhelpful thoughts can lead to changes in emotions and actions. Cognitive behavioral therapy typically involves 5 main steps. Step 1, assessment, gathering information about the client's symptoms, behaviors, and thought patterns. Step 2, identifying problematic thoughts, recognizing negative or unhelpful thoughts that contribute to distress. Step 3, challenging and restructuring thoughts, working with the client to question and modify these thoughts. Step 4, behavioral activation or skill building, engaging in activities that reinforce positive behavior and coping skills. Step 5, evaluation and adjustment, reviewing progress and making any necessary adjustments to the treatment plan. Clinical reasoning. Cognitive behavioral therapy is considered an appropriate evidence-based intervention due to its strong empirical support for effectively treating a range of mental health disorders, including depression, anxiety, and PTSD. Major treatment goals of CBT. The overall goal of CBT is to replace dysfunctional constructs with more flexible and adaptive cognitions. CBT ultimately aims to teach patients to be their own therapists by helping them to understand their current ways of thinking and behaving, and by equipping them with the tools to change their maladaptive cognitive and behavioral patterns. A typical cognitive behavioral therapy session usually lasts between 45 and 60 minutes. The number of sessions can vary depending on the client's needs, with standard CBT treatments often lasting between 12 to 20 sessions. For many conditions, although shorter or longer durations are sometimes used based on individual progress and treatment goals. Clinical interviewing skills techniques. Empathetic responses in therapy refer to the therapist's ability to understand and communicate awareness of the client's feelings and perspectives. This involves active listening, validating the client's emotions, and conveying genuine understanding, which helps build a trusting therapeutic relationship. Empathetic responses are key in promoting client openness and comfort, allowing the therapist to connect deeply with the client's experiences. Reflection is the technique of mirroring or summarizing a client's statements to demonstrate understanding and encourage further exploration. This technique helps clients feel heard and validated, promotes self-awareness, and clarifies their thoughts and emotions. Through reflection, therapists can support clients in gaining insight into their experiences and facilitate deeper self-exploration. Open-ended questions are questions that encourage clients to share more detailed responses rather than simple yes or no answers. These questions promote deeper exploration of thoughts, feelings, and experiences, allowing clients to express themselves freely and guiding them towards self-discovery. Open-ended questions are essential in creating a conversational flow that fosters insight and understanding in the therapeutic process. Summarizing is a technique of briefly restating the main points of themes that a client has shared. This helps to clarify understanding, reinforce key ideas, and show the client that the therapist is actively listening. Summarizing also helps organize the client's thoughts, making it easier to identify patterns, set goals, and transition smoothly between topics. It can reinforce progress and give clients a sense of cohesion in their narrative. Evaluation plan. We will use the GAD-7 to measure the client's anxiety levels at the beginning of therapy and periodically throughout the sessions. Our goal is to reduce her anxiety score by at least 30% over the next 8 weeks. We will also track her progress through self-reports on her ability to manage conflicts with her children. Another tool is called the thought log. The purpose of a thought log is to help clients see how feelings, thoughts, and behaviors connect. When a client connects behaviors and thoughts, it helps the client challenge irrational beliefs. A thought log takes practice, and with time, the client will form the necessary tools to challenge their thoughts. References.
Role play. First, the social worker will be Nardine and Erica will be the client. Hello, Lena. Good to see you again. I would like to start by getting a sense of how you are feeling today.
Today, I'm feeling a bit of anger and annoyance. It's been really tough. My daughter and I got into another argument last night. I try to keep calm, but it just gets so heated so quickly.
That sounds really challenging, and it must be exhausting for you to keep facing these arguments. Can you tell me a little more about what happened last night? Open-ended question.
Yeah, it just started over something small. She was upset because I asked her to help with the dishes. I know she's dealing with a lot, but when she refused, I got frustrated and raised my voice. Then she started yelling, and it just got worse from there. I feel like she never helps me out.
It sounds like you were trying to ask for some help, and when she refused, it felt like she wasn't respecting your request. That must have been really frustrating for you. Reflective listening. I noticed that you use the word never. I understand it can feel true in these moments, but could we reflect on this?
Yeah, that's all right with me.
Can you think of any moments where your daughter has helped you? Open-ended question. It can be a big or small action. Examine the evidence.
Well, she did help me last week fold the week's laundry. It only took about 15 minutes instead of it being 30 minutes by myself.
Perhaps you caught her at a good time. I bet you felt relieved having some help with this week's laundry. I know we all need that sometimes too. Were there any moments from the past week that you can recount? Open-ended question.
She did make her little brother breakfast for me one morning before school. I felt happy that she considered her sibling.
Those are great moments to see as a mom. I can see that you really feel joy from this moment. Together, we just practice examining the evidence. This means that we challenge our negative thoughts by thinking of a past time where this feeling was not true. Psychoeducation. Are there any other feelings you have been having lately regarding your daughter?
I just feel like she doesn't appreciate all the things I do for her.
It's understandable that you would feel unappreciated in those moments. When you try to stay calm but end up raising your voice, what thoughts are usually running through your mind? Open-ended question.
I don't know. I just start thinking that nothing I do matters to her and she doesn't care about helping out. It makes me feel like I'm failing as a mom.
That must be such a heavy feeling, thinking that you are failing as a mom. Can we take a closer look at that thought for a moment?
Okay.
empathetic response, and transition to cognitive work.
Okay.
When you have the thought that nothing you do matters to your daughter, how does it affect the way you react in that situation? Guiding client to identify thought patterns.
I think it makes me more angry and upset, and then I end up yelling or saying things that I don't mean.
It makes sense that having that thought would make you feel more upset and lead to reacting with anger. It's a tough situation to be in. Now, I want to explore if there are other ways we could look at this moment. Could there be other explanation for why your daughter refused to help other than her not caring? Challenging negative thought patterns. Now, we are switching roles. Erica will be the social worker and Nardine will be the client. Maybe she was just tired. She did have a rough day at school.
That's a possibility. It sounds like she might be going through her own challenges, which could be affecting her mood. By thinking about it that way, do you feel like it changes how you react in those moments? Encouraging cognitive restructuring.
Yeah, I think if I remind myself that she's having a hard time too, I might be more patient and instead of immediately getting frustrated with her.
That's great insight, Lena. It shows a lot of understanding. Let's try to work on recognizing these different perspectives when conflict happens. We can keep practicing this in our future sessions, but it's important to notice the progress you're already making in seeing things differently, summarizing and reinforcing positive change.
Thank you. That actually makes me feel a little better about handling things.
I'm glad to hear that. It's all about taking small steps and being patient with yourself. Have you ever heard of a thought log? It is a great tool that can help us work through our negative thoughts. It helps us to navigate the connection between thoughts and feelings. Could we give it a try together? Psychoeducation and thought record.
That sounds insightful. Yes, we can.
Perfect. The situation can be the conversation we were just having regarding the argument with your daughter. What thoughts ran through your mind during this moment?
I was thinking that my daughter doesn't understand all of the things I do for my family.
I can understand where you're coming from with that thought. Being a mother can be stressful. Reflective listening. Were you feeling any particular emotion during this argument?
I felt frustration and anger towards my daughter. It feels like she doesn't understand all that I do for her.
What behaviors did these emotions bring out? When you felt frustration and anger, how did you act?
I started to yell and argue with my daughter. I couldn't control how I was feeling, and I suppose I lashed out a bit.
That's an understandable reaction. It can be hard to not show our emotions to their fullest extent. Empathetic response. Let's think about some alternative thoughts that could have potentially happened during the argument. Think of more positive thoughts for this.
I could have thought about other times my daughter has helped me, and that maybe she has possibly a hard time.
That's great, Lena. You showed how alternative thoughts could change the way you behave in this situation. Would you have felt better about the situation if the alternative thoughts were the initial thoughts?
It would have definitely given me more insight into why my daughter responded the way she did. It would have helped me regulate my feelings better.
I would like to give you this handout to take home. Whenever another stressful situation arises, use this handout and see if it changes the way you react to your thoughts. I'm so glad this was of use to you.
Thank you.